Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is the pregnant client with risk factors questions. Without the way, let's get started.
A 40-year-old client at 8 weeks gestation has a 3-year-old child with Down syndrome. The nurse is discussing amniocentesis and chorionic villus sampling as genetic screening methods for the expected baby. The nurse is confident that the teaching has been understood when the client states which of the following? 1. Each test identifies a different part of the infant's genetic makeup. 2. Chorionic villus sampling can be performed earlier in pregnancy. 3. The test results take the same length of time to be completed. 4. Amniocentesis is a more dangerous procedure for the fetus. The correct answer is 2. Chorionic villus sampling can be performed from approximately 8 to 12 weeks gestation, while amniocentesis cannot be performed until between 11 weeks gestation and the end of the pregnancy. 11 weeks gestation is the earliest possible time within the pregnancy to obtain a sufficient amount of amniotic fluid to sample. Because CVS take a piece of membrane surrounding the infant, this procedure can be completed earlier in the pregnancy. Amniocentesis and chorionic villus sampling identify the genetic makeup of the fetus in its entirety, rather than a portion of it. Laboratory analysis of chorionic villus sampling takes less time to complete. Both procedures place the fetus at risk, and post-procedure teaching asks the client to report the same complicating events, such as bleeding, cramping, fever, and fluid leakage from the vagina. While caring for a 24-year-old preemie gravida client scheduled for emergency surgery because of a probable ectopic pregnancy, the nurse should 1. Prepare to witness and inform consent for surgery. 2. Assess the client for massive external bleeding. 3. Explain that the fallopian tube can be salvaged. 4. Monitor the client for uterine contractions. The correct answer is 1. The client may need surgery to remove a ruptured fallopian tube where the pregnancy has occurred, and the nurse is usually responsible for witnessing the signature on informed consent. Typically, if bleeding is occurring, it is internal, and there is only scant vaginal bleeding with no discoloration. The nurse cannot determine whether the fallopian tube can be salvaged. This can be accomplished only during surgery. If the tube has ruptured, it must be removed. If the tube has not ruptured, a linear salpingostomy may be done to salvage the tube for future pregnancies. With an ectopic pregnancy, although the client is experiencing abdominal pain, she is not having uterine contractions. After conducting a presentation to a group of adolescent parents on the topic of adolescent pregnancy, the nurse determines that one of the parents needs further instruction when the parent says that adolescents are at greater risk for which of the following? 1. Denial of the pregnancy. 2. Low birth weight infant. 3. Cephalopelvic disproportion. 4. Congenital anomalies. The correct answer is 4. Additional teaching is needed when the parent says that adolescents are at greater risk for congenital anomalies. Although adolescents are at greater risk for denial of the pregnancy, lack of prenatal care, low birth weight infant, cephalopelvic disproportion, anemia, and nutritional deficits, and have a higher maternal mortality rate, studies reveal that congenital anomalies are not more common in adolescent pregnancies. A multigravida client at 32 weeks gestation has experienced hemolytic disease of the newborn in a previous pregnancy. The nurse should prepare the client for frequent antibody titer evaluations obtained from which of the following? 1. Placental blood. 2. Amniotic fluid. 3. Fetal blood. 4. Maternal blood. The correct answer is 4. For the Rh-negative client who may be pregnant with an Rh-positive fetus, an indirect Coombs test measures antibodies in the maternal blood. Titers should be performed monthly during the first and second trimesters, and biweekly during the third trimester and the week before the due date. A multigravida client who stand for long periods while working in a factory visits the prenatal clinic at 35 weeks gestation, stating, "The varicose veins in my legs have really been bothering me lately. Which of the following instructions would be helpful? 1. Perform slow contraction and relaxation of the feet and ankles twice daily. 2. Take frequent rest periods with the legs elevated above the hips. 3. Avoid support holes that reach above the leg varicosities. 4. Take a leave of absence from your job to avoid prolonged standing. The correct answer is 2. The client with leg varicosities should take frequent rest periods with the legs elevated above the hips to promote venous circulation. The client should avoid constrictive clothing, but support hose that reach above the varicosities may help alleviate the pain. Contracting and relaxing the feet and ankles twice daily is not helpful because it does not promote circulation. Taking a leave of absence from work may not be possible because of economic reasons. The client should try to rest with her legs elevated or walk around for a few minutes every 2 hours while on the job. A client with a past medical history of ventricular septal defect repaired in infancy is seen at the prenatal clinic. She has dyspnea with exertion and is very tired. Her vital signs are temperature, 98.0 degrees Fahrenheit, pulse, 80 beats per minute, respiration, 20 breaths per minute, and blood pressure 116/72. She has +2 pedal edema and clear breath sounds. As the nurse plans his client's care, which of the following is her cardiac functional classification? 1. Class 1. 2. Class 2. 3. Class 3. 4. Class 4. The correct answer is 2. According to both the New York Heart Association and the Canadian Cardiovascular Society, this client would fit under Class 2 because she is symptomatic with increased activity, which is dyspnea with exertion. Class 2 clients have cardiac disease and a slight limitation in physical activity. When physical activity occurs, the client may experience angina, difficulty breathing, palpitations, and fatigue. All of the client's other symptoms are within normal limits. Rogam is prescribed for a client before she is discharged after spontaneous abortion. The nurse instructs the client that this drug is used to prevent which of the following? 1. Development of a future Rh-positive fetus. 2. An antibody response to Rh-negative blood. 3. A future pregnancy resulting in abortion. 4. Development of Rh-positive antibodies. The correct answer is 4. Rh sensitization can be prevented by Rogam, which clears the maternal circulation of Rh-positive cells before sensitization can occur, thereby blocking maternal antibody production to Rh-positive cells. Administration of this drug will not prevent future Rh-positive fetuses, nor will it prevent future abortions. An antibody response will not occur to Rh-negative cells. Rh-negative mothers do not develop sensitivities if the fetus is also Rh-negative. A premigravida client has completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the client that the plan of care for this newborn will include which of the following? Select all that apply. 1. Hepatitis B immune globulin at birth. 2. Series of 3 hepatitis B vaccinations per recommended schedule. 3. Hepatitis B screening when born. 4. Isolation of infant during hospitalization. 5. Universal precautions for mother and infant. 6. Contraindication for breastfeeding. The correct answers are 1, 2, and 5. The test result indicates that the mother has an active hepatitis infection and is a carrier. Hepatitis B immune globulin at birth provides the infant with passive immunity against hepatitis B and serves as a prophylactic treatment. Additionally, the infant will be started on the vaccine series of 3 injections. The infant should not be screened or isolated because the infant is already hepatitis B positive. As with all clients, universal precautions should be used and are sufficient to prevent transmission of the virus. Women who are positive for hepatitis B surface antigen are able to breastfeed. On entering the room of a client who has undergone a dilatation and curettage for spontaneous abortion, the nurse finds the client crying. Which of the following comments by the nurse would be most appropriate? 1. Are you having a great deal of uterine pain? 2. Commonly spontaneous abortion means a defective embryo. 3. I'm truly sorry you lost your baby. 4. You should try to get pregnant again as soon as possible. The correct answer is 3. The death of a fetus at any time during pregnancy is a tragedy for most parents. after a spontaneous abortion. The client and family members can be expected to suffer from grief for several months or longer. When offering support, a simple statement such as, "I'm truly sorry you lost your baby," is most appropriate. Therapeutic communication techniques help the client and family understand the meaning of the loss, move less stressfully through the grief process, and share feelings. Asking the client whether she is experiencing a great deal of uterine pain is inappropriate because this is a yes or no question and doesn't allow the client to express her feelings. Saying that the embryo was defective is inappropriate because this may lead the client to think that she contributed to the fetus's demise. This is not the appropriate time to discuss embryonic or fetal malformations. However, the nurse should explain to the client that this situation was not her fault. Telling the client that she should get pregnant again as soon as possible is not therapeutic and discounts the feelings of the expectant mother who had already begun to bond with the fetus. A woman with asthma controlled through consistent use of medication is now pregnant for the first time. Which of the following client statements concerning asthma during pregnancy indicates the need for further instruction? 1. I need to continue taking my asthma medication as prescribed. 2. It is my goal to prevent or limit asthma attacks. 3. During an asthma attack, oxygen needs to continue to be high for mother and fetus. 4. Bronchodilators should be used only when necessary because of the risk they present to the fetus. The correct answer is 4. Asthma medications and bronchodilators should be continued during pregnancy as prescribed before the pregnancy began. The medications do not cause harm to the mother or fetus. Regular use of asthma medication will usually prevent asthma attacks. Prevention and limitation of an asthma attack is the goal of care for a client who is or is not pregnant and is the appropriate care strategy. During an asthma attack, oxygen needs to continue as with any pregnant client, but the airways are edematous, decreasing perfusion. Asthma exacerbations during pregnancy may occur as a result of infrequent use of medication rather than as a result of the pregnancy. When providing care to the client who has undergone a dilatation and curettage after a spontaneous abortion, the nurse administers hydroxyzine as prescribed. Which of the following is an expected outcome? 1. Absence of nausea. 2. Minimized pain. 3. Decreased uterine cramping. 4. Improved uterine contractility. The correct answer is 1. Hydroxyzine has a tranquilizing effect and also decreases nausea and vomiting. It does not decrease fluid retention, reduce pain, decrease uterine cramping, or promote uterine contractility. One of the adverse effects of the medication is sleepiness. Ibuprofen may decrease pain from uterine cramping. Oxytocin may be used to increase uterine contractility. A woman at 22 weeks gestation has right upper quadrant pain radiating to her back. She rates the pain as 9 on a scale of 1 to 10 and says that it has occurred 2 times in the last week for about 4 hours at a time. She does not associate the pain with food. Which of the following nursing measures is the highest priority for this client? 1. Educate the client concerning changes occurring in the gallbladder as a result of pregnancy. 2. Refer the client to her healthcare provider for evaluation and treatment of the pain. 3. Discuss nutritional strategies to decrease the possibility of heartburn. 4. Support the client's use of acetaminophen to relieve pain. The correct answer is 2. The nurse seeing this client should refer her to a healthcare provider for further evaluation of the pain. This referral would allow a more definitive diagnosis and medical interventions that may include surgery. Referral would occur because of her high pain rating, as well as the other symptoms, which suggest gallbladder disease. During pregnancy, the gallbladder is under the influence of progesterone, which is a smooth muscle relaxant. Because bile does not move through the system as quickly during pregnancy, bile stasis and gallstone formation can occur. Although education should be a continuous strategy, with pain at this level, a brief explanation is most appropriate. Major emphasis should be placed on determining the cause and treating the pain. It is not appropriate for the nurse to diagnose pain at this level as heartburn. Discussing nutritional strategies to prevent heartburn are appropriate during pregnancy, but not in this situation. Tylenol is an acceptable medication to take during pregnancy, but should not be used on a regular basis, as it can mask other problems. A dilatation and curettage is scheduled for a preemie gravida client admitted to the hospital at 10 weeks gestation with abdominal cramping, bright red vaginal spotting, and passage of some of the product of conception. The nurse should assess the client further for the expression of which of the following feelings? 1. Ambivalence. 2. Anxiety. 3. Fear. 4. Guilt. The correct answer is 4. With a spontaneous abortion, many clients and their partners feel an acute sense of loss. Their grieving commonly includes feelings of guilt, which may be expressed as wondering whether the woman could have done something to prevent the loss. Anger, sadness, and disappointment are also common emotions after a pregnancy loss. Ambivalence, anxiety, and fear are not common emotions after a spontaneous abortion. A client in the triage area who is at 19 weeks gestation states that she has not felt her baby move in the past week, and no fetal heart tones are found. While evaluating this client, the nurse identifies her as being at the highest risk for developing which problem? 1. Abruptio placentae. 2. Placenta previa. 3. Disseminated intravascular coagulation. 4. Threatened abortion. The correct answer is 3. A fetus that has died and is retained in utero places the mother at risk for disseminated intravascular coagulation because the clotting factors within the maternal system are consumed when the non-viable fetus is retained. The longer the fetus is retained in utero, the greater the risk of DIC. This client has no risk factors, history, or signs and symptoms that put her at risk for either abruptio placentae or placenta previa, such as sharp pain and woody, firm consistency of the abdomen, or painless bright red vaginal bleeding. There is no evidence that she is threatening to abort, as she has no cramping or vaginal bleeding.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.